thank everyone for joining us this evening for our fantastic Midweek Matters speaker session exploring oral and mouth care. We are really privileged to have two really highly qualified speakers. Millie is a consultant in special care dentistry at Surrey and Sussex Healthcare NHS Trust and at the Royal Hospital for Neurodisability. She also developed the Health Education England National Initiative Mouthcare Matters to improve the oral health of adults in hospitals that was rolled out across England. She's the past president and current chair of the British Society of Gerodontology. She is the author of several articles in peer-reviewed journals and editor of a book on the oral health of older people. Millie was awarded an MBE in 2018 for services to NHS dentistry and the award for excellence for contribution to special care dentistry in 2023. And then we have Dr. Ahmed Kahat, sorry if I pronounced that incorrectly. And Ahmed graduated from Trinity College Dublin in 2017. He subsequently spent 2 further years in Dublin Dental University Hospital as a house officer in special care dentistry. He then moved into a family practice in the heart of Bray County, Wicklow, where he spent a few years providing a wide range of treatments. Ahmed enjoys caring for children and people with physical or intellectual disabilities. He subsequently worked in Children's Health Ireland, Crumlin Street St James Hospital, where he treats cardiology, cleft lip and or palate and head and neck cancer patients. He's currently undertaking his specialist training in special care dentistry in Guy's and St George's Hospital and East Surrey Hospital. And Ahmed currently sits on the Quality and Patient Safety and the CPD committees of the Irish Dental Association and is past president of the Irish Society for Disability and Oral Health. So it is with great pleasure that I invite both of you to join us tonight. And I'm aware we have some feedback, but that's been sorted now. Thank you for our really highly educated and informed talk on oral and mouth care. Welcome, Millie and Ahmed.
Thank you, Fiona. Thank you, Emma, and thank you so much for the invitation to speak today. We spend a lot of time talking, but often to other dental professionals and sharing the messages that we all know. And it's great to be able to talk to people living with cerebral palsy, those caring for who are carers as well. So hopefully we can raise the profile of oral health. I know that we've had a chat and we've looked at the questions, and hopefully we're going to cover all of that today. We're a bit slight. We have lots of slides, but that's just to keep us on track. And then, really happy to cover anything that we don't. So I'm just going to share my screen. And then we'll start the way and then start from here. So brilliant. So hopefully you can all see that. So we're going to be talking about oral health for people living with cerebral palsy and, focusing on adults. And and what we plan to cover is really what we sent out before, things to do with the oral health and general health links, really focusing on prevention and adaptations that can be made that might help to enhance prevention. And, talking a little bit, and then there are lots of questions about dental care and all these different services, but why do these services exist? And, what services are available, and what can actually make going to the dentist a bit more of a more positive experience, because we know it's not always a positive thing. And then also to share some resources that hopefully, if you want to know more information on, and as we spoke to Emma before, that hopefully if there are any questions afterwards, you can come back to us. So first thing really is to focus on, why is oral health important? It is there because it's, if we have our teeth and having a mouth that's functional, it helps us to eat and drink, with speech and communication, social interaction, smiling, it's really important. Dental pain is not pleasant, and hopefully you haven't experienced much dental pain, but often women often describe it as being worse than childbirth. And so we know that we want to prevent pain and discomfort, and if you do have a problem, being able to access dentistry in a timely manner. And it's important to quality of life and general health, which I'm going to talk about in a moment. But there are buts. It's really interesting sometimes when you open a paper or you're seeing adverts that sometimes, unfortunately, oral health, the focus has changed, and you might sort of see things like, oh, well, oral health is all about having white teeth. You have to have braces, you have to have Invisalign, or you have to have bleaching, or even things like Botox. And I just want to say that, that's not something, that's not the focus of dentistry. And if you sometimes when you go to dental practices, it's always you get a link afterwards saying, oh, would you like a Botox, would you like a Invisalign consultation and things. I see it when I go to the dentist as well. And just to say, yes, these are areas that surround dentistry, but the main thing really for oral health is that we want to have a clean and healthy and comfortable mouth. And just really to talk about the things that we're trying to prevent. So we know in adults with cerebral palsy, there is a slightly higher incidence of what we call dental decay or dental caries, which is when you're developing holes in the mouth. So that picture on the left, you can see a hole, and that's because holes are caused often by having sugar very frequently, and then maybe not having as much fluoride or not brushing as well. And sometimes holes can develop, and sometimes they develop, and it's not our fault. We're a bit more susceptible to it because we might have a dry mouth, or it's more difficult to carry out with some of that preventative care. So that's what we're trying to sort of, prevent or to treat is dental decay. And treating it early means we can put fillings in. If we leave it too long, it can mean the holes develop into big holes, which means that teeth sometimes have to come out. The picture in the middle there is about gum disease, which we were trying to, by effectively brushing our mouths or cleaning our teeth is really important so that we can prevent getting gum disease, which can, manifest as you might have a bad taste or a smell around your mouth, or it might be that your gums bleed on brushing. And gum disease, if it's, we sometimes call periodontitis or gingivitis, if we leave it and it goes untreated for a long time, can lead to having loose teeth as well. And also the picture on the right, sometimes there are studies which show that living with cerebral palsy, you have a high risk of having dental trauma, maybe by accidental falls, etc. So thinking about what we can do to prevent this, or again, if it happens, how do we treat this? But this is a really key thing, and I really wanted to say that oral health is more than teeth. Now, if you're looking in a paper, watching, reading a magazine, sometimes you see things like, coffee is great. It cures cancer. And the next week you'll hear coffee is not so great. It causes cancer. And it's really difficult to know when you're getting all these messages, what's true and what's not. So in terms of oral health is actually linked to our general health, but this is poorly not really understood. And people are doing lots and lots of studies. And the reason is because the mouth has bacteria in. There are more bacteria in our mouth than there are people living on the world. And if we don't clean, if we're not able to effectively remove the bacteria with toothbrushing, what can happen is the bacteria will increase and increase. It's a bit like having dirt on your hand. If you don't clean, you'll get more and more dirt and bacteria. And this bacteria it can be absorbed by the gums, and the gums are like to absorb things as a high, what we call surface area. Bacteria can be absorbed into the bloodstream and travel somewhere else into the body, or the bacteria can cause inflammation in the mouth, which then causes inflammation in other parts of the body. And thirdly, if you have more bacteria in your mouth, it can be aspirated. So if you've got a swallowing issue, which we know is higher in people living with cerebral palsy, it can be aspirated to the lungs. But looking at all of this, where there is really good quality evidence of the links between oral health and general health is diabetes and cardiovascular heart disease. So that's where we've got really good links. And then there are other links to sometimes dementia, having preterm babies, stroke, and some types of cancer. But the evidence is not as strong. But the one where there's a real interest, and I think for us today listening on this call, is the link between having bacteria in our mouth and having chest infections. Because what has been found, and it makes sense, if you've got bugs in your mouth, they are going to travel elsewhere. And some of the aspiration pneumonias have been found to have bugs that originate in the mouth. So that's why I really wanted to say that, it is true, oral health is linked to general health. Cardiovascular disease and diabetes is where there's the biggest link. Aspiration pneumonia, there is a link, but the evidence isn't as strong. But I think with time, as we do more studies and there's more research, we will show that. And it does make common sense, really. Bugs in the mouth, they will travel into your lungs. We know that. And I just wanted to say, because people get, oh, I've got a lot of tartar buildup. So that picture there on the left, that yellow stuff, which that's actually hardened minerals. And actually people with cerebral palsy, because sometimes may not be swallowing, they may be pooling saliva in their mouth. Saliva contains lots of minerals, so often you may get a faster buildup of calculus, and it's really hard, but it's not actually going to do you any harm. I always say it's similar to having limescale in the kettle. So I live in London, my kettle is always full of limescale because it's mineral deposits. Now, the picture on the right there is, you can see the dental plaque and the red inflamed gums. And this is the soft, creamy stuff you can get off of the bacteria. And this is what you can remove with a toothbrush. And this is what causes inflamed gums. And this is what causes bleeding. And this is what causes gum disease. The picture again with the calculus or the tartar, sometimes people say, it's not going to, sometimes it could be unsightly and we like to have our teeth clean, but it's not going to do you that much harm. It can only normally be removed by a dentist or a dental therapist or hygienist with instruments to remove it because it's hardened chemicals. So I just wanted to sort of explain the difference there. I'm just going to move on to, I'm going to let Ahmed describe these two slides, and then you'll hear from me again in a moment.
Thank you, Millie. Hi, everyone. Good evening. Sorry about the technical issues earlier, but that's the world we live in terms of technology. So thanks for bearing with us. I suppose the next couple of slides just talks about what kind of challenges you or the person you care for may have or may not have, but we see them kind of more often in people with cerebral palsy than people without. So I'm going to divide them into kind of physical challenges first. So the first one is in regards to spasticity or involuntary movements on the left, and that can make it difficult to open your mouth, hold still, control your jaw movements, and this complicates toothbrushing and care by the dentist as well. As a matter of reassurance, what dentists can do is they can help to support you by having by gently kind of holding onto your hands or head to provide care, or some dentists can offer sedation to reduce those movements. Many people as well with living with cerebral palsy can have poor muscle tone, or some people might even have spinal deformities like scoliosis, and that makes it difficult to sit comfortably on the dental chair, or even remain stable and in one position during oral care, oral treatment. And so we can offer support by giving cushions, pillows, a mouth prop that you can rest your jaw on so it doesn't get tired with keeping your mouth open during treatment. So those are things that can help that. In terms of another challenge might be kind of the spasticity or muscle contractions can lead to limited mouth opening. I don't know if some of you may have experienced this, but it's called trismus, and that makes it accessing your mouth when toothbrushing or the dentist to access your mouth during treatment difficult. So again, kind of sedation is a good option for that, or again, even using a mouth prop might be useful here. Some of you might use wheelchairs, and that accounts for, I read a study, accounts for about a third of people with cerebral palsy, and that obviously has its own logistical challenges, as you're aware, in terms of accessing the dentist and navigating the facilities with ramps, lifts, space for moving around. And I'll run through some different kind of facilities that a dental office might have, and might be worth asking about if you are, or when you are to see a dentist. I'll talk to that later. Another thing is dysphagia or impaired swallow, which Millie's already mentioned, so I won't linger on that too much. And it has kind of difficulty. I know some of your questions related to whether or not it's safe to swallow toothpaste in case that accidentally happens, and as a matter of reassurance it is, because we only use a pea-sized amount of the toothpaste. And from kind of a treatment perspective, the dentist usually has high volume suction, which helps to suck away any of the or most of the water that we give. And you can also ask the dentist kind of to not sit you up, to not sit you all the way back, to help with that. And then some dentists also have the ability to put a little rubber dam, kind of a little bit of rubber around the tooth to help isolate the tooth from the rest of your mouth, so that when we are working on a specific tooth, all the liquid that's coming from us is not pouring down your mouth, and it can just be held in one place with the rubber dam around it. And that might be something worth asking your dentist about as well. And then the last thing is some people with cerebral palsy might be living with other conditions like epilepsy or mental health issues, as we all go through. And with epilepsy specifically, that obviously increases your chances of getting a seizure in your dental appointment. So just making sure your dentist is aware of your medical background and how well controlled your seizures are, what medications you take, and what your rescue plan is useful as well. So thanks, Millie. Move on then to sensory kind of challenges. And people with cerebral palsy, they may kind of have a hypersensory reflex associated with a heightened gag reflex from a dental perspective. And so dental treatment near the back of the mouth, or x-rays, or even sometimes brushing your teeth can be quite a challenge. And I know this is relevant to some people here because we had a really handy Q&A session last week that Miriam kindly passed on to us, and so that is a challenge. And the first thing to do is to inform your dentist, to make them aware of that, and then the next is to think about how we can kind of train our minds. We might go back a slide if that's okay, Millie. How we can, thank you, how we can train our minds to accept instruments inside our mouth, and the way to do that might be to kind of at home to expose yourself to maybe a dental mirror inside your mouth for a period of time. Maybe start with 30 seconds and then build up every day until you get to about maybe 5 minutes. And you can get a dental mirror in any kind of pharmacy, or you can ask your dentist for a disposable one. You can buy mirrors, and alternatively, you can consider speaking to your dentist about acupuncture therapy, which can help with gagging, or they can consider numbing certain parts of your mouth, which might help to reduce the gagging. And then sedation is always an option, which I'll go through later. And then people with dental phobias, a third of the population have dental phobia, and so they might be kind of sensitive to unfamiliar tools or negative past experiences. And so again, informing your dentist is really important so they can avoid or minimize those kind of triggers for you. And some people struggle with verbal communication, and so limiting their ability to speak and express discomfort when you're at the dentist, and that can lead to kind of frustration and kind of reduced appetite to visit the dentist. And so that is useful for the dental team to know what your preferred mode of communication is. And the last thing is some people with cerebral palsy have learning disability, and that can make it harder for individuals to understand why oral care is so important, and follow instructions during kind of hygiene instructions and dental visits. And so maybe the help of the support worker might be useful in that case, and some kind of behavior management tips and tricks that we do as dentists might help those people as well. And then lastly, dentally, moving on, please, Millie. The first thing is on the left is malocclusion or misalignment of teeth, and that affects 3/4 of people living with cerebral palsy, and that complicates chewing and increases the risk of food impaction sometimes, and can make brushing a little more difficult. In these cases, it's important to speak to your dentist about areas where you might need to work harder on brushing. It's a little bit of kind of malalignment of teeth is not abnormal, and will have no long-term impact on you, provided you regularly see a dentist, and you can focus on the areas that need just a little bit more attention. And Millie will talk a little bit later about kind of how we can modify our brushing, our toothbrushes, to be able to access those kind of hard to reach areas. Millie also already spoke about gum disease, and so I won't kind of linger on that, and a little bit of tooth decay as well. And we'll talk about drooling a little later on, but it can affect up to half of people living with cerebral palsy, and it can cause it's usually caused by poor oral kind of control of the lips, or some people can have an open mouth posture, and those living with it might know that it can cause kind of skin irritation, and it can even lead to chest infections if it's coupled with difficulty swallowing. And again, we'll discuss the different management options for drooling later. Another thing I've noticed among some of the patients who I see with cerebral palsy is some of their teeth might, some of their baby teeth might still be retained in their mouth, and that's in anticipation of their adult teeth coming in, or maybe their adult teeth have come in different places around their mouth, and the picture on the right is kind of a very extreme example of it, but it's just to demonstrate that it can happen for people living with or without cerebral palsy, and so that can kind of be uncomfortable. Sometimes it's difficult to brush those areas, and sometimes some wobbly baby teeth can be sources of discomfort or pain. So be sure to see your dentist about that if that is a concern. And then lastly, some people have kind of chronic grinding, or bruxism we call it, and that can cause tooth wear, and it can lead to chipping of teeth, and sometimes it can cause jaw pain. This is tricky to treat because it's quite a kind of neurological programming that's in the brain, and it's really hard to deprogram. But there's things that we might be able to make that might help to reduce that, certainly at night time, in the way of like a night guard. But it does make replacing those teeth very, very difficult. So those are the main challenges, and I'll just wrap it back to Millie if that's okay, and then we'll continue.
Thank you so much. We're just going to, so we kind of split this into two bits. I'm going to talk a bit more about the prevention of oral health diseases, and Ahmed a little bit more about dental treatment. So prevention, we want, as we talked about, effective. Our aim is to, on a daily basis, is really to try and remove all the plaque and get rid of the bacteria in our mouth, and this can be through toothbrushing. And then we want to be able to use fluoride, topical fluoride. Fluoride is a chemical. It's in toothpaste, in some foods, in tea actually, in some areas of the country, in water. And what fluoride does is it helps to actually strengthen teeth. So it's shown to reduce the number of kids needing, developing tooth decay. If you start to get early holes, it can help to stop that progressing to a certain extent. We also want to try look at the frequency of sugar, and also remembering that when we talk about oral health, we're also thinking about oral cancer. So when we talk about prevention, it's about smoking reduction, alcohol reduction, and ideally going to regular visits to see a dental professional. And that doesn't always have to be a dentist. It might be your hygienist or therapist, and we know that there are issues about dental access, which we'll talk about later. But what I wanted to do is to talk a little bit about toothbrush adaptations. And I think this is really important because the first thing sometimes we get asked is, manual or powered? And actually, the studies show it doesn't really matter as long as you're effectively removing plaque. And that some people like having a powered toothbrush, and if you have a bit of movement, you can hold the brush, and actually if your head is moving, and just move it gently. You don't have to do as much. You don't have to do as much with manual dexterity. And also, powered toothbrushes tend to be a little heavier with the handle is larger, so it might be easier to grip. But on the other hand, some people will prefer using a toothbrush, not a powered one, a manual one we call it. And sometimes there are things that we can do to adapt them. So for example, sometimes OTs will put foam around them, thick foam, or we might use putty. The dentist can do. I used to do this quite a lot in the community, where you'd shape it around the person's hand, and they can then grip the toothbrush to make it easier. There are some, you can see there's a picture of this, the toothbrush with 3 heads, and this means it brushes 3 surfaces at the same time. And some people like that because especially if you've got a gag reflex and you might not be able to brush your teeth for, say, 2 minutes, you can do 3 surfaces. It might not be as effective, but it's still better. So lots of things that we can do, because our aim of toothbrushing is to be able to access mouth care products, be able to get the toothpaste onto the toothbrush and then grip it, but also be able to raise your hand and get it around the teeth. So some people might need some support with that, and it can be just somebody holding the hand and gently guiding. And it depends. You know, you can actually spend an hour talking about how to support people with toothbrushing, but grips can be a really good way, or having something to lean your elbow on. So that helps to sometimes reduce movements as well, is important. And then we go on to toothpaste. So in the middle there, actually removing, especially and most things are flip cap now, but sometimes toothpaste, removing the cap can actually be quite difficult. And so there are toothpaste dispensers that might be helpful. And it's really important to think about the amount. Any advert, you'll see toothpaste, use about 5 centimeters of it. You only need a pea-sized amount. And people always say, oh, well, which one do you use? To be honest, you use whichever one's on offer, generally between Colgate and Oral-B. What I'm looking for in a toothpaste is something with fluoride in. And you can see there, if you're really technical, we want a certain amount of fluoride in a toothpaste. But for some people, they find actually that the taste of toothpaste can be really, really strong and minty. And people know by mouth, for example, who are non-orally fed. And so you can get toothpaste that are unflavored. There's really one called Oral Nurse, and that has sort of no flavor. And that can be quite useful if you find that the taste, although now if you go into Boots, you can spend something like £20 on this. I think it's called High Smile or something that my kids are always trying to get me to buy, because it's mango and watermelon, and it's like, no, you have the mint, you have what's on offer like we do. So you go into any chemist or supermarket, and it can be a bit of a like, which one do I buy? So fluoride is the main thing. But for some people worry, and this was a lot of questions about, well, you know, what if I swallow the toothpaste, and what about the foaming and the gagging? Well, there are toothpaste that have, so in most toothpaste, we have this ingredient called sodium lauryl sulfate, and it's in shampoos, it's in detergents, and it makes things foam. And that's why a lot of people, when they brush their teeth, they want it to be nice and foamy. It gives them that clean sensation. But if you're an adult living with cerebral palsy, you may not want the foam, because that foam is going to be difficult. You might swallow, or it might make you gag. So there are toothpaste that, and I can send a list of that are sodium lauryl sulfate free. So things like Sensodyne is one. The things like Oral-Leave toothpaste, and they don't foam because they don't have this ingredient. So it's quite, you know, when we try it doesn't have that foaming sensation. But other things that you can do to stop the toothpaste being very watery is to put the toothpaste on the toothbrush, press it into the bristles so that when you turn it over, the paste doesn't end up on your tongue and not on your teeth. But also making sure that when you're brushing the teeth, if you have excess toothpaste in your mouth, it's okay if you swallow it. It's not going to cause you any harm. What we normally say is we want you to spit out the toothpaste if you can, or swallow it, and have the remaining toothpaste kept on your teeth, because that has fluoride. And that's why it's really important. A lot of people rinse their mouth out with water straight away. but if you're rinsing your mouth out with water, you're rinsing away all the goodness, all the stuff that we want you to keep on your teeth. And the evidence really shows that really, ideally, if you brush twice a day, once at night before you go to bed, because that means that the fluoride is on your teeth and we produce less saliva, which is protective, and at one other time during the day. So that's what I would say about toothpaste, is that you can get, is to use whichever one you prefer. Keep it dry, so don't wet your toothbrush either, because that will end up making it quite foamy. There are also other things, as Ahmed said, there's things that we use in dentistry to help keep your mouth open. But sometimes if you've got a bite reflex, so you put something in your mouth and then immediately you want to bite it. So we have, if you find that is an issue, there can be things that we call mouth rest. So that white long handle thing is actually really hard foam, and we use it a lot for people who can't keep their mouth open for a long time. So it can be people living with cerebral palsy or somebody that's had a stroke, and they can bite on it, which means you can brush on the other side. And it's also useful if somebody else is supporting somebody with toothbrushing, because people are always really worried that they're going to bite down and they're going to bite on their fingers. And then the two which look like thimbles are things that you can use in the mouth, and they're mouth guards, we call. Again, you put your finger in it and you bite on it one side and it does the same thing. You can brush. The picture down there at the bottom is called what we call a chewy tube, and Ahmed's talked about bruxism, and there are some people who are constantly grinding, and the noise can be, they may not like the noise, or they're worried about damage to the teeth, and they may not be able to wear a mouth guard. And some people with cerebral palsy may use these chewy tubes, and they can put them in, and for some people it will help. It's a sensory stimulation, so they might use it for an hour and it slows it down, or at times when they're bruxing more, so when they're stressed or at certain times of the day, they can use that to sort of just gently to put in their mouth, and then they're instead of grinding their teeth together, they're grinding on this really high strength rubber. So that's quite useful to know. Talked about toothbrush tips, ideally 2 minutes. So but it doesn't have to be 2 minutes if it can't bear 2 minutes. We normally say the sound, you can use a timer or have some music. So it's 2 minutes is a pop song. So if you can brush your teeth, if you get a really fancy toothbrush, sometimes they have timers on now. They even sometimes, some of the powered ones will show you if you're brushing too hard, they go red. You don't need a really fancy one, but you can get that. A pea-sized amount of toothpaste. If you're worried about, swallowing, then maybe a smear of toothpaste. We talked about rinsing and when to brush. The one thing I forgot was that some people, if you're at high risk of developing decay, so you have had fillings in the past, or you just something about the diet and you're at more high risk, sometimes dentists prescribe an even higher strength fluoride toothpaste that can and that's the reason we prescribe it, is just to help prevent dental diseases. Just a few other things. Sometimes, it's really important that we clean our tongues as well. And as sometimes your tongue might dry out. So there are tongue cleaners, or the tongue can be brushed with a toothbrush. If people wear dentures, the importance of denture care, I'm not going to go over it today, but I can signpost resources about getting dentures in and out and keeping them out at night. A lot of people are like, oh, we have to use mouthwashes and chlorhexidine. We don't. That's a really good marketing gimmick, really. None of us use mouthwashes unless we specifically need it. You don't need to brush it. You don't need to wash your mouth out with any of those commercial mouthwashes. Some people might like to use a mouthwash because it freshens their breath. Sometimes they're the chlorhexidine gluconate, or what we might call Corsador, so it prevents gum disease. And if your dentist or dental professional advises you, because then yes, but for most of us, it's really about toothbrushing. One of the things that is a bit more difficult to do from a manual dexterity point is cleaning in between your teeth. And cleaning in between your teeth gets more important as we get older, because what happens is our gums shrink back, there's gaps between our teeth. And ideally, we want to be cleaning in between them with little brushes. Sometimes those little brushes can be on longer handles. And again, they can have adaptations made to see if we can clean in between our teeth. Because otherwise, if we're just brushing the surfaces, we're getting to about 75% and we're not sort of missing in between. So that is something that there are adaptations again, but ideally if we can, we want to avoid flossing. We can floss, but it's not always necessary. The brushes in between the teeth are sometimes better, and getting into that habit. A lot of us dentists probably don't do it as much as we tell other people to do it. But if you get into the habit of doing it, and it might take some time, you get the hang of, which color brush. The brushes come in different colors because different colors mean like an orange or red is smaller than, say, a yellow or blue or an orange. So you know what the size of the brush needs depends on the gaps between the teeth. So that comes with a little bit of, ideally your dentist should tell you, but if not, get a small one, see how you go, and then sometimes go bigger if needed. Sometimes people get dry mouth. We talk about drooling, but often people, if you're on a lot of medication, can dry out the mouth. If you're a mouth breather, if you're on oxygen, for example. So it's really important that, where possible, it's hydration, really good lip care, so really good lip balms. There can be products that can stimulate, there are things that can stimulate saliva, such as chewing gum, which might not always be feasible, or sugar-free sweets. Having them can stimulate saliva, but also dry mouth products. Sometimes people like them, sometimes they don't. They're sprays and gels. Some people feel like it coats their mouth and actually don't like the sensation, but they can help with dry mouth as well. And I would talk a little bit about drooling and saliva management. As Ahmed has said, we're not often people with cerebral palsy, or sometimes the people we see in our clinics will come in and they've got the bib and they've got redness, this angular colitis around their mouths. And really what the advice we do, and I know we work with other allied healthcare professionals, especially speech and language therapists, is really on, posture can help, the way in which, by sitting up and having a posture. There are medications that help, but they can also have side effects. Swallowing exercises, obviously the hyoscine patches, which are really impossible to get at the moment, can help as well. But there's a lot more work going into using Botox into the salivary glands that can help reduce saliva production. And you're probably not going to get that at your dentist, but it's just being aware that it's something to talk to dental professionals about, that this is possible. Okay, so dietary advice is really about, we always have to have a balanced discussion. It's very easy to say, don't do this, don't do that. But for some people, there might be necessary to have food frequently. So we have to have what we try to say is limiting the frequency of sugar, because each time you have sugar, that will causes an acid attack on the teeth. So we try to just reduce the frequency, making sure that we do oral care after meals. If you're on any supplements, they can be quite sugary, but having that balanced discussion, really. You can have sugar, we have sugar, but just trying to reduce the frequency, maybe not having it right before bed as well. And actually, I'm going to stop sharing there because I'm going to hand over to Ahmed now, who's going to talk a little bit more about dentistry, and then we'll see you later for questions.
I wonder if you can see my screen now. Just want to double check.
Yeah, we can. It's not on full screen yet.
Ah, sorry.
That's great. Thank you, Ahmed.
Yeah, thank you. Yeah. Thanks, Lily. I will take it from here. So I know a lot of questions came in terms of difficulty accessing a dentist. So it is challenging, and I'll talk about that in a second. But just to summarize what the kind of dental environment looks like in terms of where people can go. So dentists work in a few different settings here in the UK, and they all have different kind of skill sets within each setting. So the high street dentist, that's, I suppose, is the most common and easy to access form of dentistry. It can either be private dentistry or NHS dentistry, and that's your local dentist. That's the goal, is that most people try and access their local dentist because of ease of access, is the ideal kind of environment, which is what the government kind of strives for, but obviously we know it's unfortunately not the case currently. The next thing is your community dental service, and these are dentists who may or may not be specialists. And in this case, we're talking about kind of pediatric dentists if you're less than 16 years old, or special care dentists who are for people who are more than 16 years old. And generally, that service is for people with kind of additional requirements, such as those who have learning disabilities, those who have medical complexities, and a certain cohort of, for the purposes of this webinar, a certain cohort of people with cerebral palsy. And a few kind of community dental services want you to have a local dentist as well as seeing them for treatment. So that might be kind of something to look into, is the fact that it's important to establish a dental home locally if possible. And then if not, there's ways around it that I can talk about later in terms of how to seek dental services. So it's great in a way, because the skill sets and the facilities are usually tailored for people with additional requirements when receiving dental treatment. But there are disadvantages in that the waiting lists can be very long, and they can be hard to access. And there is a small, well, there is a cost associated with some of the community dental services if you're not exempt from it. So it can range from anywhere from £25 for an exam to up to £300 for more complex dental work. And then lastly, you've got your hospital service, which is where Millie works as an example. And these are consultants or specialists who kind of treat the most complex of patients within the community. So people with a combination of the issues that or challenges that I had previously mentioned might be kind of best suited to hospital service. And I'm just trying to skip to the next slide. In terms of kind of access to NHS dentistry, it's difficult. There's no getting away from it, and I feel the frustration that some of my patients come in saying that they're just finding it impossible. They've called everywhere, and they haven't had very much luck to find a dental home. And you're not alone in thinking that, because there was a recent report by the British Dental Association that said 97% of new patients or people seeking dentistry are unable to access NHS care. And so we hope that improves, but unfortunately that's the environment that we live in. But we'll talk about kind of how to kind of navigate that in environment next, in terms of what the alternative is. So ideally, you ask your own dentist to refer you into the community dental service or hospital service, depending on where you sit from a kind of medical complexity point of view, and they will then refer you for treatment. If you don't have access to an NHS dentist to refer you in, then you can seek a private referral, or get referred in through your GP or medical consultant. So the pathways of being referred in vary depending on the area that you live in. So that's something for your kind of referring healthcare professional to know. So that might be a matter of kind of searching online for what the nearest community or hospital service is that accepts special care dentistry or pediatric dentistry if the patient is under 16, and then going about the appropriate pathway based on what you find your local service requests. And that onus is with the referring clinician. So you don't have to kind of do that yourself per se, but you do have to kind of take the initial step to try and seek that service through ideally your own dentist or NHS dentist if you don't have one privately, or if not, a GP or your GP or another healthcare professional, or like a consultant who you might see. So I hope that answers some of the questions. This is a video here, just to kind of demonstrate what our aim is in terms of offering care, regardless of whether or not it's dental, in the NHS, and what the goal is. And it's ideally to kind of center it around the needs and the priorities of the person, and so therefore it's called patient-centered care, which a lot of you are, I'm sure, familiar with. And I'm going to see if it works in a second. Yeah, it doesn't work, but to be honest, it was a minute long that I could probably explain, because I've watched it so many times. But it's if you do want to see it, it's from the Nursing and Midwifery Council. It's available on YouTube. I'll link it in the chat at the end. But it's ideally trying to establish, the goal is to establish a relationship where they understand what your specific needs are, and that's kind of, and they use those needs to give you information and advice based on what you're seeking, rather than this whole kind of, you should do this, this, and this, and kind of same kind of information given to everyone, because everyone's different and everyone has different priorities, and so we should treat people differently accordingly. And so yeah, I'll move on to the next slide in terms of, this is kind of more relevant for the people who care for people with cerebral palsy, for those who are listening currently or are listening on YouTube at a later stage. So the long-term, this is very much in keeping with the long-term plan of the NHS, which says that people will get more control. The aim is to get people becoming independent and having kind of that autonomy to decide on what treatments they wish for themselves, and therefore the treatment is more personalized when they need it and how they need it. And this is kind of a little summary about kind of how to do it, but in the interest of time, I'll probably kind of skip the step-by-step on how to do it, but just know that there are plenty of resources on how to kind of implement patient-centered care. Moving on then to different adaptations that dentistry can offer for people with cerebral palsy. In terms of patient positioning, I know kind of a dental chair might not be an ideal environment, an ideal area for you to receive care. Usually I find that people prefer to be in their wheelchairs if they have one, and that can be possible, especially if your wheelchair self-reclines, and that makes it even easier. And sometimes, however, it might not be possible depending on the type of treatment that we're offering, or that we would advise doing for you. And so that's when moving on to a wheelchair tipping device might be useful, which is the second photo from the right. And so that's a dummy using the wheelchair tipper function. So you can see the floor of the tipper is flush with the flush with the floor, and so it then just tips back using your own wheelchair. It's quite secure, it's quite handy, but most practices don't have this, and so it can be kind of difficult to try and find a practice with it. However, certainly if you're within a community or hospital service. If they don't have one there, they will be able to advise you on where you might go in order to get one, or have treatment using one. And then we can offer kind of cushions and supports that I spoke about earlier. If you are able to get on the chair independently, or if you need assistance, which might help kind of control some movements and just make you a little bit more comfortable in your time. And then the last thing is hoist transfer, which some facilities again have that hoist available to transfer you onto the dental chair or bed, and so we can carry out treatment that way using your sling. So then moving on, in terms of communication, I am going to take it that you're better at communicating and expressing your views than I'm going to explain to you. To be perfectly honest, I think patients, I notice that patients living with cerebral palsy who are often the best placed to be able to explain what their preferred mode of communication is, and know the different modes of communication out there as well. And so I suppose it might be useful then to then explain that to the treating dentist. So I guess your role in this situation would be to inform your dentist about what your preferences are in that way. And there's no such thing as being rude if in terms of if the dentist is speaking to you away from your eyesight, or if the dentist you can't hear the dentist, or the dental nurse, or the therapist or the hygienist, then please do let us know, so that we can kind of tailor our treatments and communication with you in a way that you understand and appreciate. And we're happy to adapt. Some of you might have a hospital passport, which might be very useful to bring with you to appointments, and then you can show your dentist that way. And I have the next slide here on different communication aids that can be used in to kind of help to inform and kind of correspond with the treating person. But I have a feeling that you probably know all this, and so I'm happy to skip it, but I'm also happy to come back to it if the questions at the end suggest they'd like me to go through it. But everyone has their preferred way, and it's just about making sure you bring your preferred way with you if it is kind of bringable, and explain to the dentist, this is how I like to talk. And so moving on to kind of other adaptations that we can do in terms of behavior management. So in terms of dental anxieties, and in terms of kind of movements, and just kind of becoming more familiar with the environment that you're in. We can kind of implement some calming techniques, such as pressure desensitization, and I suppose forehead rubbing is more so for people who have kind of a learning disability coupled with anxiety. We found that quite helpful, and music therapy. We're more than happy to listen to music here in our surgeries. So if you have any suggestions, please do let us know, just even as a distraction tool, if nothing else. And then we have cognitive behavioral therapy, which some of you might be aware of. And the idea of that is it helps to manage your anxiety by reframing your fears and promoting a positive kind of coping mechanism within yourselves, and so that you can implement it at the dentist once you arrive. And some techniques that are used are things like gradual exposure, by kind of slowly integrating you into the dental environment, or certain relaxation exercises, and it can also be used in people with mild learning disabilities as well. It's been shown to be quite effective. And then the simple things like keeping appointments short, and if that's what you prefer, again, tell the dentist. And having kind of someone who knows you, someone who's comfortable to advocate for you, that you can trust with you at appointments, is often helpful as well. And then again, I mentioned before, in terms of if there is kind of movements and with your consent, we're happy to gently support your head to help, or your hands to help with treatment. And then we've got kind of different medicines that we can use in addition to these other behavior management techniques. The first of which is pre-medication. So sometimes we might correspond with your GP to give you a little bit of a kind of a sleeping tablet, just to help take the edge off when you come into the appointment, particularly if you're very nervous coming in and you're having a sleepless night the night before. It can be quite helpful to do that. So ask your dentist about that. Inhalation sedation is another option. Now that's with gas and air, so it's a mask that you breathe in and out using your nose, and the gas is a combination of oxygen and nitrous oxide, and it's the same gas that they used for pregnancy, for labor. And what it does is it also kind of helps to take the edge off your anxiety. It also helps to reduce some of the pain that you may, but hopefully won't, experience at the dentist. And it's really good for some people as well in terms of managing gagging, but it doesn't work for everyone. And so, maybe that's a conversation to have with your dentist about that option. The other option is sedation, which I mentioned previously. And again, that's very much case dependent. Some people sedation can work really well with, and then other people sedation might not work so well with, or it might not be appropriate, or might not be the safest option to do. And so I suppose the benefits of sedation, we have several drugs that we can offer, but the benefit is to kind of reduce your anxiety, to allow better mouth opening, to reduce some of the muscle movements, reduce gagging, and also it's an anti-epileptic for people who do have epilepsy. Disadvantages is that, again, it's not for everyone. Some people might not find it helpful. Other people, it might not be safe to do for, because as well as that, it also reduces your level of breathing. And we do not want to do that. We do not want to cause more harm than good here. And so the other thing is it may involve, if there's a lot of treatment to do, may involve multiple appointments. Yeah. And then the last option is general anesthesia. And so that's when you're, did it go away? Sorry, I think it just restarted. My apologies, but I'll just keep talking about general anesthesia option. That's when you're put to sleep for treatment. And the idea being that you're seen by an anesthetist, so they put you completely to sleep, and obviously that carries with it its own risks in terms of the anesthesia, in terms of sore throat, which is quite common. Then you have the rarer risks, such as anaphylaxis or allergy to the anesthetic, and then you have kind of the most serious risk, which there is a slight increased risk. There is a slight, very, very small risk of mortality as well, which is why it's often a treatment option that we do as a last resort. I'm going to try sharing my screen again. Sorry.
Ahmed, I can share. Oh,
good. So it also comes with advantages in that we can do all of your treatment in the one go, which is great. And it might also mean that we can collaborate with other specialties, like ear, nose and throat consultants, ophthalmology to look at your eyes. Sometimes we collaborated with podiatry to check your feet, and then sometimes we collaborate with the GP to get maybe blood tests if you may not otherwise cope with blood tests. And so I mentioned the disadvantages as well. And then lastly, in terms of kind of the dental treatment options that we do provide a whole host of different options. The most important is what's in the green box. Prevention is the most important thing that we can offer you. And that's why it's so important to see your dentist even before you have any dental problems, so that we can anticipate any problems that might arise, fill the teeth that may cause problems in the future rather than take the teeth out that are currently causing problems, and kind of fix some of the habits which will reduce any risks for you in the future. If you do need a filling, we can do a filling for you for teeth that are fixable. We remove teeth for teeth that are not fixable. Sometimes we do root canal therapy, whereby we keep the tooth, but we remove the nerve from the tooth. And then sometimes the tooth might need a cap or a crown on top. We're quite selective unfortunately, in the cases that this applies to, because it's quite a complex procedure, and not everyone is able to cope with such a complex procedure. And it's very technique sensitive as well. And then sometimes in relation to missing teeth, we can offer things such as bridges or dentures. Very occasionally, implants might be an option as well. But again, every case is different, and so this is a conversation to have with your dentist about the appropriateness of each of these options. And then for gum disease, we treat with scaling your teeth, and more importantly, brushing your teeth and teaching you how to brush your teeth effectively. And then sometimes braces is also an option. And then I'll just move on to the resources, which Millie, you might be able to shed a little bit of light on.
Yep. These are actually, well, I'll probably send some actually. Got some of our Matters resources which are useful, videos and guides. I put the British Society of Gerodontology, but I'm going to change it to British Society of Specialist Dentistry. We have lots of resources, and some from Wiley, their resources for carers, but also for individuals themselves about oral health. So arrange that we can send you afterwards and available in your resource. So to more information needed.
That has been absolutely fascinatingly brilliant. I am very aware of the time, so I'm going to throw a couple of questions at you. I've been making notes as we've gone along, and I'm just going to caveat it all by saying that we're not going to get through all the answers to all the questions that we covered last week. Some of them, a lot of it was included in the talk, but there were a few that weren't. So.
And also, sorry, Miriam, there's a few here on the chat, so I think that's probably where we should start.
I know, I'm just absolutely. So I'm just going to say that any that we don't cover, whether it was talked about last week or in the chat, we will make sure that we get that information to everybody who's on the talk. So the first thing was around physical access to your dentist. So if you physically, because they don't have access facilities there, you physically maybe can get into the dentist, but if there's a step or something to go up to another area to have a procedure, how are you meant to navigate that? What would you suggest?
So, I mean, any practice that was built after the Disability Discrimination Act should have access for people. The problem is that a lot of dental surgeries are in really old buildings, and because they were built before, they don't. So really, it should be, they shouldn't, on the website, that is something that they should have, whether there is access for people who require a ramp or a lift or even parking. And this information should also, but I know it's not always there, especially for NHS practices. There should be, if you Google or search find a dentist, it should tell you which patients are accepting NHS patients currently, which ones have added, which ones have access, but it isn't always up to date. So you can ask your people that now commission dentistry are called our integrated care board, but you could ask, you know, a healthcare professional, can you find out for me? But the problem is that we have a lot of dental surgeries built in very old buildings, and they don't have to have will purpose. And if I built a practice tomorrow, it has to, but we still have this backlog of
So I
places.
guess, Millie, the question really is, though, and with all the understanding in the world, and I think we're quite an understanding community, that things are not always as up to date as we want them to be. But if you find yourself in the situation that your local dentist that is the one that is taking NHS dental but doesn't have that, do you have a right to ask for a different dentist, or will somebody help you navigate that?
Yeah,
Or what the process should we go through in order to find a dentist that is
you can go to
available?
any dentist, and if there isn't a if your dentist say if the local one doesn't have access, then they can refer to a community dental service who will have access, because all community dental services will have access, will have wheelchair access or ramp access. However, it doesn't mean that you can't go to a general dental practice if they do have if you are able to get in via a ramp or via a lift.
So what you're saying, if I'm hearing you correctly,
Yeah.
if your local dentist has access, then you can use that. But if your dentists don't, it is grounds for referral to community to ask for a referral into the community.
Yes, yeah,
That is an access
asking, hopefully, like local healthcare professionals might know if you're seeing another health professional, do you know a dentist that has access? Do you know one that's got a car park that's, you know, accessible rather than, you know, 20 minutes away as well? Because as Ahmed said, the wait for community dental service is a long time, and some people may choose to go privately. Some people might want to go to a private dentist, and if they do, then there will be some, and it should on each website talk about accessibility. We have to make arrangements for physical disabilities, but also hearing, visual, or impairments. Yeah.
And can I just clarify regarding community dentists, do they, like high street dentists, fall into private and NHS?
No, so with community dentistry, it's purely NHS service.
Okay.
And with that, it may or it may not come with a cost, depending on whether or not the patient has an exemption from those costs. And like I said, there's 3 different bands, but depending on the kind of treatment, it can start from as low as £25 and it can go up as high as £300, say if you need a denture. But that's broadly speaking, it's all NHS.
Fantastic. And then I know you've got a sheet explaining how you navigate to special dentistry care as well, special needs dentists. So if you can't see a high street dentist, just to clarify, could you either go to a community dentist or ask to be referred to a special needs dentist? You have those 2 options?
Yeah, so a lot of special needs dentists also work in the community. So there is quite an overlap between the 2 of them. But yes is the answer. So say your dentist, for one reason or another, doesn't see you, then you can ask, or generally the dentist will just refer you, because there is a duty of care there from the dentist perspective, to provide care for any patient that comes into the door. To refer you to the community dental service, or to refer you to a hospital service, depending on your level of complexity. And it is usually with a referral sheet, very similar to the one that I showed. But again, it's the responsibility of the dentist to do that. And every community service has its own kind of unique way of referring in. And so unfortunately, there's no kind of national easy pathway for it. But again, it's not, you don't have to kind of bog yourself down as the patient in terms of how to do that. It's the dentist's responsibility.
And I'm just reading the chat, and I don't want to butt in, but I'm just reading the chat and people talking about discrimination and that kind of language. And I think just listening to you and also my knowledge of the health service, I think it'd be worth having the conversations around duty of care rather than discrimination, and where who is responsible, who's got the duty of care for my care, and how can you help me navigate it in that kind of way, because that might be the language that you might want to choose to use when you're having those kind of conversations rather than discrimination in that way. I think that might be useful.
And just going to slightly more practical things, I know you had some really fantastic slides, Millie, showing adaptive equipment for brushing your teeth and also sort of supporting the mouth. But you also talked about the flossing aspect and how as you get older that is quite important. Now, obviously, the ones that you can just pick up in the high street, that if you have poor coordination, manual dexterity issues, that's a little bit of a challenge. Someone put in the chat that they tried water pick, which seemed to work quite well, but she got water everywhere. So I'm just wondering if you've got any other suggestions?
Yeah, I mean, I was looking at the chat and I thought that's really, it's good because flossing, I'd say, is the most difficult thing to do. Even if you have the best mannered dexterity in the world, it can be tricky and it gets harder. So the brushes, the long handle brushes are probably easier. But again, if we can put adaptations, actually, we've learned today, maybe we should be talking more about water picks because I can see that been lots of people saying that, yes, you get water everywhere, but it works for them. It's probably because it's one of the things that I don't know. I've not actually ever used the water pick, but maybe I need to go and buy one and see what it feels like. But I know some of my family have that might be something that if it works well. Because at the end of the day, what we're trying to do is just stop food and plaque stagnation. And I was researching whether there'd been some evidence, and it does show it's a relatively new gadget, but it does seem from the feedback here, so Mike, take it to you, that it actually does work because I think it is difficult to clean in between teeth. I think getting the outer surfaces, and that's when sometimes, asking somebody else when we're talking to in hospitals and care homes and things about people who can't brush, and we can get people to brush their teeth, but we can never really get people to clean in between. It's a very difficult skill. Some people might get on a bit better with brushes as well, the longer handle ones, because they're easy to get, especially if you've had a tooth taken out, we've got a big gap, but those little gaps can be tricky. So I'll take from this is I think I need to go and try a water pick. There's one thing I wanted to ask, because there was a lot about dental access and what Ahmed has said, and places like Health Watch, for example, are really good, at helping. Sometimes you're just stuck in this, like, how do I help? And it's important to reach out. Like if I say, yes, contact your local commissioner, it's very easy for me to say that, but practically, how to do that. But if you do look at find a dentist, there's always things like, if you can't find, here's a complaints email or a phone number. But I think Health Watch, they come on a lot of our commissioning meetings. We always have a rep, and they're the people that might be there to be able to help as well, or be able to get that feedback about, dentists without the access. If you're in a wheelchair, because that can be really frustrating. You finally find a dentist and there's a big step there and you can't get into it. So that recommend talking to your local Health Watch. They're great, or local advocates as well. We know dentistry is it's just such an awful situation now for NHS dentistry, and then that puts pressure on all the other services. Unfortunately, we can't solve that. Anyway, it could be if we could see everyone, but there's a lot of work going on by the BDA and British Dental Association and things as well.
Can I pick up, just perhaps because I've got a speech therapist biased, and the dysphagia management and the swallowing issues. I just wanted to highlight what was really exciting for me to see is that there is ways of you working in somebody's mouth and not creating that extra saliva or liquid that somebody has to manage, because I think that's creates some sort of fear around going to the dentist. So I just wanted to kind of underline that and underscore that actually, and I just kind of wondered is how much would a dentist know about that you'd see in the high street? And you talked about being open and honest, and if you spoke to them about whether they had that kind of equipment, would that be offensive, or would that go down okay, do you think?
I think it's a really good point that you raise, and I think a lot of us dentists and patients alike are kind of afraid of kind of the elephant in the room, or kind of worried to discuss certain things. But honesty is the only way that you can establish that kind of patient-centered relationship. And I think that often is a barrier, is kind of growing up in the UK, and we're so used to kind of etiquette and kind of PC culture. But ultimately, we're here to care for you, and the more we know about how you like to receive care, the better we'll be able to care for you. And so it's a win-win. So never be afraid to be honest. In terms of asking that question, absolutely fine. To recap, the simple things often are the most effective things, like not sitting all the way back to provide treatment, which is dependent on the type of treatment that the dentist is doing at the time, but important to have that conversation nonetheless. Being mindful to take regular breaks in between treatments, or every 10 seconds, 15 seconds, just to collect yourself. And the double suction, we have two different suction arms that we can often use with the assistance of the dental nurse. And then the last thing I did mention was the rubber dam isolation, which is growing within dentistry, and that is basically kind of a piece of rubber that or latex that surrounds a single tooth or multiple teeth at a time. And so if we're doing a filling, for example, then we are able to avoid the water going anywhere else, just isolates it to that area and then suck it all up. But it's not possible to do that, say, if we're cleaning your teeth, because we need access to your entire mouth and underneath in the gums, so we can't put a rubber dam around treatments like that. Or if we're removing a tooth, for example, as well, because there'd be nothing to put the rubber dam around. So there are lots of different options, and sometimes we can pick and choose what's appropriate depending on what you need and depending on what the treatment is.
So the message that we're getting is oral hygiene, looking after your mouth, and prevention, which is not uncommon message that we give for all of our healthcare, but particularly today in terms of your teeth and oral health. It's important to go early if you can, and to get as regular checkups as you can. Is there any other burning questions, Mim?
No, I think a lot of it has been covered, and then if there is anything else, I can liaise directly with them. Millie and Ahmed.
Can I suggest for those who use a water pick to use it in the bathroom when they're taking a shower? So if you're wet anyway, you may as well use a water pick at the end of the shower. So.
And I also, just to underline that you said that actual flossing wasn't important, but that it's about getting in between your teeth, that it is important. Sometimes we use it synonymously. We use the same word to mean, but actually it can be different. But everybody's saying what a wonderful talk this evening, and how much we've learned. It was a real privilege to have you on. You're a mine of information, and I've answered, I think, most of the questions that came up last week, most of the conversation that was happening in the chat. So thank you very, very much.